Right now. Good evening and welcome to the broadcast. Now, clinical officers have agreed to end their nationwide strike after signing an agreement with the government. The strike has paralyzed services in public hospitals across the country. The agreement was signed between their union officials and the Ministry of Health. Mwangi Maina begins our broadcast tonight.
A meeting held at Afya House early Friday morning between Health Cabinet Secretary Mutahi Kagwe and officials from Kenya Union of Clinical Officers unclogged part of the stalemate that has rocked the health sector. Clinical officers have been on a go-slow for the last 26 days.
We are glad because I think there is headway and we have agreed on the matters that have been in dispute and that has taken us on strike for the past 26 days today.
In the return to work formula signed outside the Ministry of Health buildings, parties that had been at loggerheads agreed on 17 issues touching on the welfare of clinical officers working in public hospitals this period of COVID-19. Among issues agreed upon is a group insurance cover, provision of PPEs and renewal of contracts, as well as enjoyment of benefits for officers hired on contractual basis.
We have provided on how we'll ensure that they get supported in terms of the PPEs, frequently checking on whether they are available and whether they are adequate. That is quite well covered. And we have also provided on how our members will be able to get medical cover and also group life insurance.
After the signing of the return to work formula, the strike was called off immediately, with clinical officers directed to report back to work within 24 hours.
We have therefore agreed that if all these issues have been agreed and as we have signed, the strike for the Kenya Union of Clinical Officers members across the country shall actually be called off immediately, and we therefore ask our members to resume duty within the next 24 hours.
On their part, nurses are adamant that they will not resume duties until all their issues have been addressed. However, Kenya National Union of Nurses KNUN Secretary General Seth Panyako is optimistic that the gridlock will be unlocked after a meeting with the ministry Monday next week.
It's only through dialogue that issues can be resolved. But chest thumping and grandstanding, giving directives without rationale cannot help any issue. We are all Kenyans. We are all leaders in our own capacities. I want to make it very clear that we will not sign a return to work agreement just because it looks like that one for the doctors, so that it looks the one for the clinical officers. Our return to work agreement must address pertinent issues affecting my members.
The government retaliated efforts to ensure all healthcare workers are working in conducive environment.
For avoidance of doubt, may I state that the government is committed to ensuring continuity of services to our people without disruption, and we will do everything possible to get all our striking workers back to work.
Health workers have been up in arms, accusing the government of neglecting them in the face of COVID-19 pandemic. As the clinical officers signed the return to work formula, nurses are still proceeding with their strike. Health CS Mutahi Kagwe asking them to hasten the process of negotiations, call off the strike and go back to work, saying that every health worker is needed to ensure Kenyans get health services without being troubled. Mwangi Maina, TV 47, Nairobi.